Hello.
Hello, Miss Jones. How are you doing today?
I'm good. How are you?
I'm good. I'm going to be your nurse for today. My name is Naisha, okay?
Okay.
Provide privacy, do hand hygiene. I'm going to listen to you today, and I'm going to change your dressing and change out your drainage system, your chest tube drainage system, okay?
Okay.
Do you have any allergies?
No.
Can you tell me your name and date of birth for me?
Sheila Jones, May 4th, 1989.
Are you in any pain?
No.
All right. Are you having any trouble breathing?
No.
Okay, we're just going to raise your head of your bed a little bit to make sure you don't have any aspirations. I'm going to check your orders to make sure that I have the appropriate dressing for your chest drain, your chest tube. And if you're in any pain, I'll make sure you have some medication for that. All right. I'm just going to listen to you for a second. Is that okay with you?
Okay.
I'm going to put this on your finger to measure your oxygen level. Take a deep breath in for me. Okay. Can you turn on your side for me?
No.
Okay, I'll listen to your lung sounds when I turn you on your side, okay?
Okay.
Your oxygen level is 99, which is good.
Okay.
I'm just going to take a look at your dressing, okay? I'm going to check around it, palpate around it to make sure she don't have any inflammation, any redness. I don't see any drainage coming from her on her dressing or anything. And then I'm going to look at her tubing to make sure she don't have any kinks, make sure it's unlocked. And then I'm going to look at her water level to make sure she's at the 2 centimeter mark, just like her orders say, and make sure she don't have any continuous bubbling. I'm going to make sure her bevel is out. If it's not out, I will make sure she's on the appropriate amount of suction. So now we have the bevel out, which is good. If you have any continuous bubbling like this, you will make sure you notify the doctor because the tube can be out. Okay, Miss Jones, I'm gonna have you turn on your side, okay? We're gonna change your dressing.
Okay.
I'm gonna help you, okay? Turn on our side. Alright. I'm going to change my gloves, perform hand hygiene. And put on another set of gloves. I'm going to take off this dressing. Then I'm going to look at it to examine it to make sure she doesn't have any drainage coming from the tube, any redness or inflammation. I'm gonna look for signs of infection. All right, Miss Jones, I'm just gonna clean around it, okay?
Okay.
Clean around it to get any crust off of anything or any old blood. And I'm gonna toss that. And then usually this is a wet to dry dressing change. So I'm going to place the wet one on first. And then I'm going to put the dry. Okay, your chest tube looks pretty good, okay? Then I'm going to check to make sure she don't have any kinks or anything in her tubing. Then the same thing I'm going to do is check her levels, make sure she don't have any bubbling or make sure her bevel is up. All right, Miss Jones, I'm going to change out your drainage system, but first I'm going to listen to your lung sounds, okay, in your back. Can you take a deep breath in for me? Again. Again. Last one. Alright. Your lungs sound pretty good, okay? I'm gonna also measure her respirations, you know, and look at her, how she's breathing. So I'm gonna look at her chest expansion and all of that. Okay, I'm gonna put you back on your back, okay? So now, looks pretty good. Take off the old gloves. Do hand hygiene. Now I'm going to put on a new set of gloves. Now I'm going to change out your drainage, your chest tube drain system, okay? First, I'm going to clamp the tubing, and I'm going to make sure I do 1.5 to 2.5 inches from the insertion site, and I'm going to put it an inch apart from each other on opposite sides. Now I'm going to turn off the suction, and I'm going to get her chest tube system. I'm going to open it out the pack, and I'm not going to touch it. Now it becomes sterile. Hand hygiene. Get my sterile gloves. Now I'm going to make sure they have the appropriate amount of water in the seal, which is 2 centimeters. And I'm going to take the new system, and I'm going to change out the tubing from the old one. Take the system off. Make sure my tubing does not have any kinks in it. Make sure this is unclamped. Going to undo the clamps. And I'm going to turn on my suction to whatever the doctor's orders say. And I'm going to make sure my bevel is up, and I'm going to make sure that I don't have any bubbling in the suction part. And then I'm going to straighten up the patient. All right, Miss Jones, everything looks pretty good, okay? If you need anything, let me know. Here's your call bell. I'm going to lower the bed back to the floor. And I'm going to keep her sitting up just because of aspiration precautions, okay? And then I'm going to take my gloves off. And I'm going to do hand hygiene again. And now I'm going to document how the patient tolerated the dressing change. I'm going to document everything that I've done for the patient as far as assessment and changing out the drainage tube system. And then I'm going to make sure she's fine still before I leave. And then I'm going to do hand hygiene again, and I'm going to do skill complete.